What's up, Nutrition Hero family? This is Dr. Brad Watts, and you are listening to another episode of the Nutrition Hero podcast, where, as always, we're celebrating both the art and the science of functional medicine clinical nutrition. So I'm recently back from a seminar teaching in Baltimore, Maryland, and had a good time. I appreciated the people that came out to learn more about functional blood chemistry to support their patients in a way that I don't think many of them have ever heard before, so I appreciate that. One of the things I like about teaching so much is being able to give away the clinical pearls and the how-to. Not just a, like, hey, look for this in clinical practice, but a, here's what you do when situation. So, looking forward to doing more of that coming up as well. If you are somebody that is implementing clinical nutrition or functional medicine in your office, make sure you get to a biogenetics seminar teaching blood chemistry. It's going to be taught in a way that I've never heard it taught before. And I'm not saying that just because I'm the guy behind the microphone. I'm saying that because it's something that we've put together to be able to penetrate through all of the chaos, all of the static that happens in the functional medicine world. And so giving you strategies and tools and how to. So anyway, I enjoy it. The next one's coming up, I think in November in Arizona. If you want more information on that, please get a hold of Kari, Karii, at biogenetics.com. Kari at biogenetics.com, and she'll get you set up there. All right, so if you are listening to the podcast today, probably a few weeks ago now, I promised you something, and it's taken a little while to put together, but we're going to do it today. We are going to go through organic acid testing and the usefulness of it, and what I think, this isn't going to necessarily be like a clinical review of like all of the different markers, etc. I want to talk about the usefulness of this test, and really what I think is the utility of it. It's kind of like a Swiss Army knife, and I say that because it comes in handy in so many different types of cases. It could be somebody with diabetes or thyroid disease, little kids. I love this test with little kids because you will find, is this little kid, are they farming yeast? Are they farming poor metabolic function? And it is something that it may shock you every now and then. You'll see a test and you go, oh my goodness, what is going on with this patient? No wonder they feel the way they feel. Or no wonder I haven't been able to move the clinical results in the right direction as fast as I would like them to. So a few years ago, I started running this organic acid test on my patients as a standard intake procedure. And the reason I started doing that is because it looks at so many different metabolic processes in the body, and it gives you an analytical approach that I don't think you can find anywhere else. And when you combine it with blood chemistry, like from a functional perspective, or hormone testing, like salivary hormone testing, it gives you a leg up on the competition, number one. But number two, it gives your patients the ability to, you put a battle plan together with them. You put it together in a way that they're able to move in the right direction at a faster rate and a more predictable rate. So anyhow, I think you'll see that the usefulness of this test is second to none. Now, the Great Plains Laboratory is sponsoring this podcast episode today, and they are specifically the lab that I have chosen to use over the years. I've run other organic acid tests from other labs, but the Great Plains Laboratory, they do a good job at putting the data in a way that's consumable for the patient on the test. So it's easy to explain. They have an interpretation in the back of every laboratory analysis. And that interpretation, however scientific it might be, they do a good job at explaining it in terms that a patient can understand. And I find a lot of value in that because it makes my job easier. And ultimately, the patients enjoy knowing what the issue is. And not only that, but knowing what the follow-through is. And so that's an important piece of the puzzle as well. So I appreciate the Great Plains Laboratory being on board today to sponsor this episode. And so anyway, with that in mind, what I want to do is talk about how you start with most patients on an organic acid profile and what it actually looks like. What are we trying to accomplish? And how does the process actually go? So typically in my style of practice, a patient would come in and we're going to go through an organic acid sample with them. It's a urine sample, and it's awesome. No blood, all right? So little kids love this test. All they got to do is pee in a cup and we're good, okay? And what happens is that this test is measuring the metabolites or the breakdown products of biology. And so we're measuring it in the urine. And so the same way that if you put fuel in your car and you mash it together with a spark and oxygen, you get some combustion, and out the tailpipe comes some carbon monoxide. And based off of how much carbon monoxide is coming out of that tailpipe, you're actually able to measure the function, like what's the overall function of this car? Is it doing a good job? Is the engine participating the right way? You're able to see it. And it's a phenomenal tool, right, for an automobile to be able to measure the carbon monoxide. Well, this is no different. This is a phenomenal tool for us to be able to measure over 70 different metabolites based off of a urine sample. I think that's pretty awesome. When we look at the function overall, what we want to be able to do is categorize it into different systems of the body. And when we categorize it into different systems, what we're looking at is essentially gut function, number one, metabolic function, number two. We're talking about Krebs cycle, electron transport chain, that kind of stuff. And then number three, we're looking at neurologic function. And these are all a reflection of these three areas. It's not a direct measurement of the amount of yeast in somebody's belly, right? What it is, it's a reflection of overall concentrations. So, for instance, you have a little kid that comes in and they have a rash, right? Well, I'm not going to just try a bunch of supplements on that little kid. First of all, I want to find out, what is the rash coming from? Is it a bacterial issue? Is it a yeast or a fungus issue? The organic acid test allows you to analyze that. It allows you to put it into a picture format that really, it gives you the name of the chemical that is in too high of an abundance. It gives you the name of the chemical that is there and ultimately is contributing to the issue. Now, it doesn't analyze 1,200 different types of yeast or strains of mold or anything like that, right? We're not looking for 1,200. We're looking for families, for categories. And one of the biggest ones that I find is Candida. This is a way for us to analyze a patient sample and come up with, is this patient dealing with a Candida issue? Well, absolutely. So when we look at it, it does a very good job of breaking it down. So I think we have 8 or 9 different markers that are looking for yeasts and fungus. We have, I think, 6 to 9 different markers that are looking at different types of bacteria, like the Clostridia family of bacteria. C. diff, if you've ever been into a hospital and you walk in the sliding double doors, right, and off to your left-hand side or your right-hand side, whatever that might be, there'll be a sign on the wall that says something to the effect of like, hey, we are committed to low infection rates. Like, you don't want to see that when you walk into a hospital, right? So I was at a hospital in Colorado once visiting a patient, and there was a huge banner in the lobby hanging from the ceiling that said, we're committed to low infection rates. And I was like, I think we're done here. Let's get out of here, right? And what that is they're talking about Clostridia family of bacteria. They're talking about Clostridia because it's so insidious. So when you look at maybe your population of patients you're treating, nurses, little kids that have been in the hospital and they just haven't been quite right since they came out, Clostridia is everywhere, right? I have maybe one nurse I can think of that I've treated over the years that was Clostridia free. Otherwise, anybody in healthcare, in the traditional setting of healthcare, they have all, almost across the board, had an overabundance of the Clostridia bacteria in their body. And it wrecks their immune system function. It wrecks their ability to participate just like on an ongoing basis. And so when we look at running an organic acid panel, the usefulness of it is second to none. It's crazy. It is crazy. So one of the next favorite things that I like about the organic acid test is the ability to analyze and measure the effectiveness of the mitochondria itself. Effectiveness of mitochondria itself. Oh my goodness. You get a diabetic patient. So, that's politically incorrect, by the way. You get a patient with diabetes. There we go. I'm always PC here on this program. You get a patient with diabetes, and patient with diabetes comes in, and obviously they're not regulating their blood sugar appropriately. Is it actually insulin resistance, or is it that their mitochondrial function is not participating appropriately? Think about that. Is it like the engine isn't churning the right way, or is it they literally are just eating too many bagels? Well, very rarely do I find that the patient is eating too many bagels. That might be a contributing factor, but very rarely is that the one thing that a patient needs to take care of. And what I find is that oftentimes the organic acid test is going to show you that a patient's mitochondria is breaking down. Like, there are 9 nutritional steps in taking oxygen and glucose and mashing them together and giving you ATP, and then you exhale CO2. There are 9 nutritional steps in that. You can measure all 9 of these with an organic acid test. So if the patient's citric acid cycle isn't, or Krebs cycle isn't, participating appropriately because they literally don't have vitamin C, you can find that out. If it's a B6 issue, you can find that out. If it's an iron issue, you'll see the reflection of poor hemoglobin production on the blood chemistry. You will see decreased mitochondrial function on an organic acid test. It is phenomenal. So when you can look at a patient in color, so to speak, when you can look at a patient and actually analyze to the T the steps of their mitochondrial dysfunction, nobody else is going to do that for them. Nobody. And if your patient's not regulating blood sugar because they have a B6 issue, you probably want to know about that. If they're not regulating blood sugar because of, they have chronic scurvy and nobody's ever analyzed that for them, you want to find that out. You're going to see the reflection of vitamin C. You're going to see the reflection of B12, B6, B1, B2. You're going to see the reflection of these things on the mitochondrial assessment profile and the nutritional deficiency assessment. This is a way for you to specifically improve the quality of life that your patients are living. You're going to provide them detail that is so organized and so in depth that it gives them the ability to improve their function overall. It is phenomenal. Most of those patients are actually willing to do something about it when they know why. Now, maybe it's the human condition. Maybe that's ultimately a problem with helping people, is that they need to understand things before they're willing to participate appropriately. But I think that this test gives you a leg up on that because it explains it in color for the patient. So really, really cool. Now, in addition to the mitochondrial dysfunction pathways that you'll see, it also can give you an opportunity to participate with nutrient deficiencies. And so obviously all of these are going to be water-soluble nutrients, but you can analyze the building blocks for glutathione, like N-acetylcysteine. You can analyze glutathione itself, so GSH, knowing what's their breakdown like of glutathione. What's the breakdown like of vitamin C, of the B vitamins? What is their body doing with the nutrients they're actually taking in? So it's not just assessing, how much are they getting. It's also assessing what are they utilizing, how fast are they spending it. So if you have somebody that's taking 500 milligrams, let's say, of vitamin C a day, and you look at their organic acid test, and their organic acid test says 000 for their vitamin C breakdown product, what that means is that what they're taking in, they are effectively spending very fast. Either that or they're not absorbing it at all, which can be an issue with vitamin C, which is why I like liposomes so much. Now, when you look at N-acetylcysteine, a building block for your body's strongest antioxidant, glutathione, if your N-acetylcysteine is below the reference range, it's not going to be surprising to you to see 000 for N-acetylcysteine breakdown. Meaning there's none left that they can measure in the urine after the patient's been sleeping all night, and then they wake up and do a fasting urine sample. Now, when that happens, that's an issue because you need glutathione. You need glutathione. It's one of the chief detoxification chemicals of your body, and it's a scavenger. It is a very, very strong antioxidant. Now, when your building blocks for glutathione are so low, what are you expecting that patient to be able to accomplish? If their building blocks are very low, right? If there's not enough Lego pieces to build the Lego house is going to be kind of crappy, right? So it's a way for you to analyze in the breakdown, where is the problem? Are they actually creating glutathione as fast as they should? Or, like me, if you're watching this on YouTube right now, you get these wrinkles on your head, right? It's a sign of increased tissue breakdown. It's a sign. And it's increased oxidation. Another sign of that would be fatigue. Another sign of that would be joint pain or irritability. How about that from a nervous system perspective? If somebody's got a really short trigger, you can analyze their antioxidant structures and the breakdown product of them, and are they building it, number one, and number two, are they utilizing it? So the organic acid test is really, as I said, a Swiss Army knife amongst single nutrient, single action, practicing doctors. This is a way for you to be able to participate on a much broader scope. So hopefully that makes sense to you. Another thing that I very much appreciate about the organic acid test is being able to look at the chemical breakdown of glutathione itself. You can look at the organic acids that result from glutathione utilization, and you can understand if they are high or low, if there's a demand being put on glutathione or not. So let's say you have a patient with diabetes. Oxidative stress, yes, there's going to be an issue with oxidative stress. Does this patient with diabetes also have, are they thin? Maybe they're a skinny person with diabetes and they diagnosed with type 2, right? Like, are they dealing with decreased ability to clean up the reactive oxygen species on the inside of a cell? And that's ultimately causing insulin resistance so that, the body's protecting itself from over-oxidation. So think about the mechanism from a backwards perspective. So increase oxidation, the cell doors shut themselves, right? So now we don't get any of the GLUT2 transporters. We're allowing glucose in, those sodium-dependent ones. And then now doctors say, well, you have insulin resistance because your blood sugar is so high, more blood sugar in the bloodstream rather than in the cell itself. And so you can see this in color, in detail, on an organic acid test. That right there is worth the cost of the test itself. I think it's a little over, maybe around $200, I think the cash price is for their test. They do have an insurance model with it. I found that, just the hassle of going through the insurance situation is way more than it's worth to the patients, because ultimately it's going to end up being a cash purchase anyway. But with that in mind, the usefulness on cracking the code, right, or busting the case wide open for some of your patients is just amazing, So, all right, in addition to working on somebody with type 2 diabetes with this organic acid testing, what do you do for follow-through? How do you implement biogenetics products that I like to use, obviously, as I teach for them? I'll use biogenetics products to pair with these organic acid test results because they are not single nutrient, single action. Okay? They are multiple nutrients that have a variety of actions at the same time. I appreciate this because you can hit entire sections of the organic acid test with biogenetics supplementation and food. Food is a very strong player in this game, okay? So let's say, here's an example for an organic acid test result. Somebody comes back with their organic acid test, their OAT test, and you have an elevation in the breakdown products of Candida, okay? So maybe we're dealing with something like arabinose. Arabinose is elevated. Dealing with some level of overgrowth in the body. Maybe mitochondrial function is decreased, dealing with elevations as it comes to the mitochondrial markers, and also seeing vitamin C is low, glutathione utilization is low, and N-acetylcysteine is low. This would be a typical profile that you would see come back with this patient. How are we going to implement a strategy in order to help this patient heal? Number one, you can't have sugar. You can't have sugar. If we're just going to increase the candida situation by fertilizing it with simple sugars, they're not going to be a patient in my practice. Okay, this test allows you to give them an form an opinion about you as a doctor, as a provider, because you're telling them, well, not just, hey, you have diabetes, you can't have sugar. You're telling them, hey, you have diabetes, you can't have sugar because you also have this overgrowth of candida in your belly, which is more than likely where it's at, like small intestine, and you need to make sure that we stop fertilizing it. Okay, now they're going to go to the primary care doctor, and the primary care doctor is going to follow the MyPlate government recommendations or the American Diabetes Association recommendations, and they're going to say, you need to be eating more carbohydrates, right? You need to eat more carbohydrates. How are you supposed to balance your blood sugar, patient, without carbohydrates? It's like they don't know that vegetables are carbohydrates for some reason. And so what happens is the patient gets this conflicting information, and what do? You slide the test over to them across the table, and you say, here's why. You have candida. You're going to continue to fertilize this candida, and it's going to continue to wreck your world if we don't change your dietary programming. And so now you're not arguing over whether or not carbohydrates are good for diabetes. You're arguing over whether or not carbohydrates are going to be helpful for candida. And this ultimately fits the functional medicine paradigm because you're not talking pathology, you're talking dysfunction. Everybody's got candida on some level, right? And it's never going to be zero. But the point is that if it's an overgrowth situation for your patient, you want to find out. You want to know relatively swiftly so that you can move them from a dietary programming perspective in the right direction. All right. Now, one of the things that I didn't know about when I first started running this organic acid test, one of the things I wasn't aware of was its usefulness for neurochemistry. I wasn't aware of the effectiveness when you talk about looking at a reflection of the concentrations of Lactobacillus rhamnosus, for instance. Okay, I wasn't aware of its effects on GABA production. So I read an article the other day that was talking about how people are getting GABA to be produced in the small intestine microbiota, or like the flora in the gut again, by utilizing Lactobacillus rhamnosus. It's a probiotic, a very specific strain that is taking away people's anxiety issues. Why? Because it leads to GABA production. GABA, the neurochemical. Okay? Well, how cool is that? You can see the reflection of this on the organic acid test. I love it. I love it. So we're talking little kids that have social anxiety disorders, or adults, people that are taking antidepressants, anti-anxiety meds. You can see the reflection of this stuff on paper. What's really cool is you can see the breakdown product of dopamine and serotonin as well. And not only that, you can develop a treatment strategy for your patient based off of these organic acid profiles. I mean, the company itself gives you recommendations based off of the medical literature, which I think is going above and beyond what is even expected from a laboratory company. So very, very cool. Now, one of my favorite ones is looking at the breakdown products that are dealing with tryptophan. We're talking about serotonin production here. And we're not measuring serotonin specifically, okay? We're not getting into the nerve itself and measuring serotonin. We're measuring the breakdown product of it. We're measuring the exhaust, so to speak, just like the car. So remember the car here. When we go through this and we look at somebody that is dealing with anxiety, or they're dealing with high blood pressure, or they're dealing with sleeplessness, I'm going to look at this organic acid test through that lens, and we're going to assess their situation as it relates to the breakdown of tryptophan. If tryptophan, now there are many chemical steps that go down the road here, but if tryptophan ultimately ends up 5-HTP, which ultimately ends up in serotonin. We're going to look at the breakdown product of serotonin, and one of the ones that we're going to measure is called 5-hydroxyindoleacetic acid. 5-hydroxyindoleacetic acid is a reflection. It is not serotonin itself. It is a reflection of what we're looking for. Okay? And when we look at this, tryptophan, if you break it into two, it basically has two pathways it can go down. One, we can create serotonin. Two, we can create something that is much less useful in the body called quinolinic acid. Quinolinic acid is like a neurotoxin. It's an excitatory neurotoxin that can create inflammation in the nervous system. And so when you look at somebody's utilization of tryptophan, if they're funneling it towards quinolinic acid at an incredible rate, they're going to have the effects of quinolinic acid on the nervous system rather than the effects of serotonin. This is going to be the person that, I'm not going to say it's clinically diagnostic of depression or anything like that, but I will tell you that in every single person that I've ever run this on that is on SSRIs or has anti-anxiety medication, it's skewed. It's off. It's not appropriate. Okay? And this is a big deal. What's happening is that when your body is under stress, inflammation, might be a gut infection, might be stress from work or a family situation, might have just been in a car accident. What's happening is your body is taking tryptophan and you're funneling it towards quinolinic acid production instead of serotonin production. You're funneling it toward quinolinic acid because of the inflammatory issue, because of the infection, because of the stressful assault that you're under. That's a problem. This happens in many, many cases, especially with people with diabetes. Right? With diabetes, here's what you're going to see on organic acid test. You're going to see that they have a yeast situation. You're going to see that because of that that stressor in the body, they're taking their tryptophan that they're utilizing because Dr. Oz told them to use tryptophan in order to fall asleep, or whoever. Okay, not to hang that on Dr. Oz. But the point is they read it online or they heard it on TV. Take tryptophan, right? It'll help you relax a little bit more. And take melatonin, same thing. Well, what they're not aware of is that you can reverse engineer melatonin and tryptophan into quinolinic acid rather than building serotonin with it. It's a problem. You're going to see it. And anytime that you take an inventory of somebody's supplementation that they're utilizing when they come see you, if you see tryptophan or melatonin on there, I want you to start thinking about this mechanism because you're going to see it on the organic acid test. You're going to be able to hit pause on it, turn it around, and move them in the right direction so that they can function more appropriately. So they can get a little bit of their quality of life back, for crying out loud. They're going to love it. They're going to love it. So organic acid testing, again, this is just a brief overview of some of the application of it. Vitamin C, glutathione, we look at those processes. You're going to see it not in every patient, but in many patients. And then right now, just as you go, what are we in September here? The end of September. You're going to have patients that are going to be sending little kids to you. They're going to bring in their kids because their kids are going to be going through the end of the first quarter of school coming up here at the end of October, right? And I want you to remember this. Remember, or even bring it up, right? Put a flyer in your office that says, are your little kids doing well in school? Are they making it right now? Or are you getting emails from the teacher every day that says, Johnny's a psychopath, okay? Like whatever it is. He doesn't listen or she doesn't listen. They can't focus. They can't read. What I'm telling you is run an organic acid panel on these little kids. Just do it. Run it. A screen. It's a urine sample. They mail it in. A couple weeks goes by. You get it back. Let the patient go through, or let the parent go through parent-teacher conferences. And then you're going to implement, and there's going to be a change in that little kid. It is awesome. It is awesome. All right. I think that's all I have for you here today, just as far as applications of the organic acid test. Obviously, we could talk for hours on this, especially if we get into specific mechanisms and how to unwind them. But more than anything, I wanted you to get a taste of the usefulness, and I want you to actually call the Great Plains Laboratory, get it organized, get yourself the organic acid tests, and make sure that you get some kits into the office, get your patients to utilize them. The number again is 1-800-288-0383, 1-800-288-0383. All right, you've been listening to the Nutrition Hero Podcast. I'm Dr. Brad Watts. And once again, keep celebrating the art and the science of functional medicine, clinical nutrition. You're going to change somebody's life.